Hi, everybody, and welcome to today's edition of Recap with Rep Jess. I'm coming to you a little early today because we got out of session at a decent time, and I figured why not give you all an update so that you have the latest as quickly as possible. Today was definitely a tumultuous day in the State House. There was some invigorating debate around one of the constitutional amendments, and there were some very outspoken people on both sides of the aisle, whether we were talking about Representative Russ Diamond or Representative Malcolm Kenyatta. Both spoke very strongly for the points of views of their party. And we'll talk about that a little bit more when I dig into the votes that happened later today. So up next is the Rep Jess rundown. So coming in at the #1 spot, impeachment is in the U.S. Senate. It'll be certainly interesting to see how that all plays out. At #2, the Pennsylvania GOP desperately wants to change our state constitution, bringing numerous potential amendments to the floor this week and next. Rep Harris has asked me to be one of his deputy whips, a happening which takes the #3 spot on our list today. The whip's office helps count how members intend to vote on bills, so each deputy whip, like myself, will be responsible for keeping track of a group of legislators. At #4, the Pennsylvania GOP voted against equal protections for people with disabilities and LGBTQ people yesterday, which gets a big boo from me. And last but not least, on the same subject, I gave my first floor speech yesterday, asking for support for protections for all Pennsylvanians in our state constitution. It's short, sweet, and to the point, and here it is now.
As a member of the LGBTQ community and a woman with a disability, I'm concerned as to why we need to enshrine the rights of some marginalized groups, but not others. To live in a state where I can be denied opportunity and freedom simply because of who I am is no longer tolerable. We must ensure rights of access for individuals with disabilities and those who use service dogs. We must fight for non-discrimination protections for LGBTQ people. And yes, we ought to ensure that individuals in our Commonwealth are not discriminated against on the basis of race or ethnicity. But if we are not here to defend the rights of every Pennsylvanian, then I must emphatically say, Mr. Speaker and my esteemed colleagues, then why are we wasting our time and taxpayer money on this drivel?
Drivel is such a fun word, isn't it? And it drove right to the point about why are we fighting for the rights of some instead of the rights of all in our state house. To move on to an update about my committees and the bills that we're working on, all 3 of my committees have now met to reorganize, but have not conducted any business beyond that. In terms of our bills, I'm super excited. I have with me here today, you can see it. This is our first bill, and it is ready to be introduced. So the paperwork for that is sitting right next to me here. That is our bill that would require health insurance companies to cover all costs related to COVID-19 testing, treatment, and prevention. So I'm incredibly excited about that. I'm also happy to announce that my 3rd bill, we talked about my 2nd one, which is with Rep Miller around fair funding for kids with disabilities in schools. But my 3rd bill, we're just about finished drafting the bill text. And this would be around Pennsylvania's crisis standards of care. Crisis standards of care are the guidelines and rules that our state has to follow in a case when medical resources or other resources may be scarce. There might not be enough of them to go around. And right now, the way that those crisis standards of care are written, they're potentially discriminatory against folks with disabilities and people with pre-existing or chronic conditions. And so my piece of legislation would help address that disparity. We've got the bill text just about done, but the legal department is reviewing it. So make sure to keep tuning in to hear an update on how that fight progresses. All right, up next, we have an update on our vaccines. Some of you may have seen the recent articles. There have been 3, 4, maybe 5 at this point, where Senator Williams, Senator Fontana, Representative Sarah Namorato, and myself have been calling out the need for better communication and clear organization around this vaccine distribution process. We don't seem to be getting much of anywhere on that, but we're certainly trying. And on our vaccine town hall, many of you sent in questions that we didn't have time to get to. So I'm going to go through those now, and there's a lot. So tune in to hear a lot of information about what's going on with vaccines, and I'm going to try to explain things as clearly as I possibly can. Because as you all remember on our town hall, there was definitely a lack of clarity. So one of the questions was, how is the $100 million from the federal funding being spent by the state to help vaccine distribution? This funding is going to assist in several ways. One of those is that as the Department of Health develops contracts and partnerships to assist in vaccinating the public, some of that funding will be used as part of those contracts. It's also going to be used to help communicate with the general public, which is something that I'm really excited about because clearly we need some big improvements there. So that'll be how that gets spent. The second question, can the state put greater requirements on the hospitals or pharmacies to distribute the vaccine more readily instead of storing them for any amount of time? And they responded that the Department of Health has been communicating to hospitals that there is no need to store the vaccine, that they will continue to provide them with allocations, and that they want these entities who receive the vaccine to use the vaccine as quickly as possible to immunize Pennsylvanians. Now, hopefully that'll happen. We really need to see some more movement there. Third question, are you aware of distribution complications that are impeding delivery? And they responded, the major complication we and all states are experiencing right now is vaccine supply. Supply is limited and far below the demand for the vaccine. So basically what happens is that the federal government allocates the vaccine to the state. So the feds determine how much vaccine we get. And so far, it just simply has not been enough. Now, we saw some exciting news today where the Biden administration has made a deal to purchase more vaccines that should be enough to cover the entire population, literally everybody in the United States by the end of summer. So we'll see if that comes to pass, but that was the latest news as of today. Let's see. Another question, people who are in the 1B category should not wait to be called because no one will call them, right? They should just recognize or find out when 1B is activated and then reach out to the nearest hospital or pharmacy to try to get the shot, right? So that was the question. And the response from the Department of Health was yes. Once information is shared publicly that the state is moving to 1B, those who are in that phase should visit the vaccine provider map on our website, find a location near them, and reach out to set a time to get vaccinated. From my perspective, this isn't good enough. Obviously, my office will be communicating to you all what phase we are in. But you have all heard my criticism of that mess of a vaccine provider map and the fact that you really should not have to call so many pharmacies or go to so many websites to try to figure out how to get this appointment. So I'm going to continue to put pressure on the Department of Health because I'm not satisfied with this answer. Here's another question. Is the state in the marketplace for the vaccine itself? Is it private industry in the marketplace for it, or are we all dependent upon a federal procurement contract? So all vaccine supply, according to the Department of Health, has already been purchased by the federal government. So there's no extra vaccines that we could try to buy separately because all the purchasing and distribution is being handled by the federal government. So that goes back to this, there's so much demand for vaccines and we're getting just this trickle of supply from the federal government. Could EMS personnel administer mass vaccination sites once we are at that point? Is another question. And yes, once we have that many vaccines, they would have the training necessary to be able to do that. Are unlicensed caregivers, like family members caring for disabled or elderly people, eligible in 1A? And the answer is yes to that. We had numerous questions about individuals with health conditions who are not yet 65. Are they still in 1B? So those with high-risk conditions causing increased risk for severe disease are included in 1A. And there was a list of conditions created by the CDC, and I'm going to drop that into the comments here, so you should be able to see that list there. Now, here's where the disconnect is, because on the state level, we're saying yes, those individuals with health conditions who are below the age of 65, yes, they're included in 1A. But Allegheny County is saying they don't have enough supply to vaccinate those people yet, so they're limiting it to folks 65 and up. And I have asked that the state and the county Department of Health figure out how to get a joint message on this, because I'm really tired of hearing one thing from our state and another thing from our county. I think that's unacceptable. Here's another question. When can we reasonably expect mass vaccination clinics in our counties, and who are the players coordinating those? The Department of Health says that the Wolf administration is actively working to plan for what mass vaccination clinics would look like, working between the Department of Health, the PA Emergency Management Agency, county partners, and other partners in this effort, and they'll share that information as soon as they have it. And of course, I will pass on that information as soon as I have it to all of you. Another question here, what is the procedure for volunteer fire departments to get registered for the vaccine? So volunteer firefighters are in phase 1B. So when Pennsylvania moves into phase 1B, it would be best if one individual from the fire department reaches out to vaccine providers in the area to set up an appointment for the entire department to be vaccinated at once, to simplify things. What is the procedure for a person with a chronic illness to get registered for the vaccine? So individuals with those specific conditions listed in that link from the CDC should determine an enrolled vaccine provider in their area and determine what steps they will need to take to register with that provider. That's the answer from the State Department of Health. Now, like I said, again, Allegheny County is saying something different. They're saying they will not vaccinate folks with chronic conditions who are under the age of 65 yet, that they don't have enough vaccine. And again, I'm calling for them to figure out a unified message here so that we are having one clear communication about what is going on. Another question. Is there any time frame or procedure for teachers and school administrators and workers to get registered for the vaccine? So school employees are in phase 1B, and this recent increase in the 1A population is going to impact the timeline for when we move into 1B. So keep paying more attention to what I tell you in the future here about when we're ready to move to that. And I'm going to keep pressing at the state and the county for more information there. Okay, let's find another question here. What is the Department of Health's oversight on who receives the vaccine? So they said that the interim vaccine plan includes a decision tree and other information to assist providers in determining who is eligible for vaccination, and they should be referencing that information in their vaccination efforts. So it essentially sounds like there is no oversight or enforcement there. And let's see here. I think this is probably the last question. We've gotten a number of questions asking about the numbers behind vaccine rollout. People are asking questions about how many vaccine doses the state has versus how many have been given. Are both first and second doses included in the number reported by the Department of Health, or is that number only first doses? The numbers being publicly reported, according to the DOH, include those who are both partially vaccinated with just the one shot and those who are fully vaccinated. And you should be able to see all of that information on the vaccine dashboard, which I'm going to link and drop in the comment section here as well. There you go. So you should have that link. Oh, and here's one last one. Which phase covers caregivers who work for a home care agency? And that is phase 1A. So that is a bunch of Q&A on vaccines. If you have other questions that I didn't answer, feel free to drop those in the comments and I will reach back out to the Department of Health to get additional questions. And like I said, I am keeping the heat on. I don't think that the answers that we are getting are good enough. And I'm going to continue to press for better communication where we're hearing the same thing from the state DOH and the county DOH, and a clear organizational plan, a centralized place where people can sign up to get sorted into a phase, put in their contact information to be put on a wait list. And rather than having to continually check in or make phone calls, we're going to make sure, I'm going to keep fighting to make sure that, it's just a wait list and then you'll be contacted, because this, as it stands, is an absolute hot mess. And I am frankly tired of it. So I'm going to keep fighting for us and doing what I can here. Okay, so that was, I think, all of the questions that I had down on vaccines. And that pretty much concludes our show here today. Oh, I did tell you guys I was going to talk about the votes. I almost forgot about that. So let's bring up the bills that we voted on final passage today. So there were 4 bills that we voted on final passage today. So HB 14 was a bill that would allow for survivors of child sexual assault to have this 2-year window opened up where they would be able to seek justice. And I voted for this bill because I think it's really critical that we ensure that we give folks the ability to seek justice. HB 55 was a constitutional amendment bill. And the thing about this bill that got a little bit tricky, and I did lay this out on Twitter. So if you follow me on Twitter, you're going to get that like super up-to-date information about how I voted on a thing, because I literally live tweeted from the floor. But HB 55 is a constitutional amendment that would essentially require the state legislature to approve the governor's emergency declaration order. And I ended up voting against this for 2 reasons. The first reason is that we would lose out on $1.9 billion in federal funding, and that requires us to have that emergency declaration. And this is really critical because there are organizations like our municipal governments, like our volunteer fire departments, our school districts, heck, even our unemployment money relies on this as well. And so, I wanted to make sure that we had that necessary financial support for our boroughs and all of the other organizations in our district that rely on that funding. And then the second reason why I voted against it is because the COVID-19 emergency declaration isn't the only one that's currently going on. Governor Wolf also has one around addressing the opioid epidemic, which would also be impacted by this. And as so many of us know, House District 36 has more deaths from overdose than any other part of Allegheny County. And if we were to, put this amendment to our Constitution in place, that would impact the ability of folks to get the treatment that they need to address and to get into recovery. So those were the 2 reasons why I voted against it. There was that financial consideration, and then I also wanted to make sure that folks who are suffering from substance use have the resources that they need. Now, I heard from folks in the district on both sides of this one, folks who wanted me to vote for it, folks who wanted me to vote against it. And there were more folks who wanted me to vote against it than for it. So that was definitely a factor as well when we're thinking about representative government. But I also wanted to give you the 2 very practical reasons too. So you are clued in on that. And then the other 2 here, I'll bring our bill numbers back up. But the other 2, HB 104 and HB 108, were good government oversight bills. And these were ones where I was going against what Governor Wolf was really wanting us to do. But basically, these bills would provide much needed checks and balances and oversight from the legislative branch. So I voted for those 2. Okay, so that was the last bit then. Today was my last day in Harrisburg, so I will be heading home here. But I hope you all have a wonderful rest of your Wednesday evening. And of course, any questions that you have that come up, definitely let me know. But this has been your recap with Rep Jess. Take care.